can just come here so that even those ones can see. Yeah.
Sorry, we are not used to this. We are used to being behind the scenes. This is an ambush. Okay, anyway, if you are in the room, please don't log into the Zoom so that we can avoid the echo and the feedback from the room. 2, whatever you're talking in the room, make sure that you talk on the microphone because we are also catering for the people who are online. So if you avoid talking to the microphone, it means that they're not getting your sound properly. And the people on Zoom, the chat is open. So if you are experiencing any problem, please do a chat and then let us know if you're experiencing any problem so that we can handle it technically. Otherwise, I wish you all the best and let's just observe the rules. 3, movements. Please realize the cameras are on and they are recording. So by any chance, pita chini ya camera. Yeah, so let's avoid some movements. Thank you very much.
Thank you, Achaga. We'll now hear from the panelists. And to start us off is the Country Program Director, AHF, Dr. Samuel Kinyanjui.
So thank you very much and welcome to this session. The purpose of today's meeting is to state very clearly AHF position and other people who mind about healthcare and wellness. And we're focusing on unfair practices, mainly by pharmaceutical companies, and in this respect, specifically today, Gilead. And on it, COVID treatment, COVID-19 treatment, among others. I just wanted to mention that, first of all, is that Gilead being one of the top, among the top 15 largest pharmaceutical companies in the world, they make tremendous amount of money and dedicate a lot of their money for what we would call self-perpetuation at the expense of their customers, making thousands of percentage in terms of profit, while a lot of patients in the global south cannot afford their life-saving treatments. Lots of these treatments, the science was generated in universities, in research institutions, most of which were funded by public resources. So we consider this unfair. I'd like first to focus a bit on why hepatitis C, so that I can leave a few of the other things for my co-panelists to zero in. So hepatitis C, a lot of us may not have heard about it, but it's a major problem in this part of the world and in Kenya in particular. Globally, we're looking at almost 3 million, almost 300 million cases in a single year. And about 1 million people lose their life, 800,000 plus lose their life every year. But let me come back home. And the challenge is that we are looking at nearly 1 million people, because it's about 2% of the Kenyan population, 50 million people, have estimated to have hepatitis C. And out of this one, people living with HIV, about 1.4 million Kenyans, 4 to 5% of them also get hepatitis C. And the combination of HIV virus infection and hepatitis C is quite lethal. The other group that is also, most of the time you read in the literature you may not hear about, is that nearly 10% of healthcare workers also get hepatitis B, because the mode of transmission of hepatitis C is through fluid contact. So it can be contact with blood, but it also can be sexual. The other group, in terms of risk, I'm going up 10% healthcare workers, 15 to 20% of sex workers also have hepatitis C. And the group that is greatest affected are people who are injecting drug users. Up to 40% of them have hepatitis C. So when you get hepatitis C, so what? About 15 to about 30% may recover naturally. The rest, 70%, almost to 80%, proceed to either acute illness, which is chronic liver disease, and in the next 5 to 10 years, 10 of them will die from chronic liver failure. Another 10% may proceed to get a terminal illness, most people call liver cancer. And of the chronic liver disease, about 5 of them every year proceed to get the cancer and die. The challenge with hepatitis C is also that we have no vaccine. Hepatitis A and B, we have vaccines. But hepatitis C, we have no vaccine. So the best way to control it is find the people early, put them on treatment. The challenge is the price of the treatment. If you're in the US, I believe the price per day is very close to $1,000. In Kenyan terms, that would mean 140,000 a day for 8 weeks. So you need close to 12 million Kenyan shillings. If you're in Kenya, you may get generics from some of the companies that have been contracted by Gilead. Contracted in that, although they have a patent to do generics, the price at which they will sell to you is controlled. It will cost you anywhere between 60,000 to 400,000. And this is the reason a lot of people cannot afford. And that's why we are here to say these treatments, the real cost of production is not that high. But Gilead, because they keep the patent close to them, they control the production tightly and unfairly, they risk lives of million people out there in the world every year. In Kenya, we are looking at several million because we have nearly 1 million Kenyan people. In the general population, among the people living with HIV, we are looking at between 100,000 people every year needing this treatment. Some of them may go undiagnosed. Health workers are not spared because of the nature of their work. Sex workers are also not spared because of the nature of their work. That we can reduce this also by using protectives like condoms, healthcare workers, gloves and so on, but a lot of the time, because of the nature of their work, they are exposed. And the people who inject drug because of their lifestyle and related issues, they are also exposed. It is unfair for one company to be making 1,000 plus in terms of profits by sacrificing lives of millions of people. That is the call we are bringing today, and would like that Gilead looks at the even international conventions that says that pharmaceutical companies are required to improve access to life-saving treatment. There are several clauses in the UN conventions that requires them to do this. They're flouting them all the time. I'll stop there, and the details that we have in terms of the other people who are at risk and other groups that are involved, like Truvada, which is a very important drug, which is being overpriced, and also the treatment for COVID-19 will be, the details will also be included in a press release statement that we will release. But for now, I'd like to stop here in my opening remarks and give my co-panelists an opportunity to say a couple of things that has motivated them to feel that they have to say something, raise their voice on behalf of the many people who are voiceless. Thank you.
Thank you, Dr. Kinyanjui. Let's hear it from Kenya Legal and Ethical Network, from Mr. Tim Wanyonyi.
Okay, thank you, and good morning all. So on my side, I think I will continue from where Daktari has left in calling out the grid by Gilead, and specifically to call out Gilead for its misuse of the patent system to profiteer at the expense of lives. So one way in which Gilead is misusing the patent system, we do know that the patent system actually exists to be able to for innovators to be able to recoup their profit, but for a limited period of time. However, noting this, there's a loophole in which Gilead misuses this, first of all through what we call patent evergreening. So one thing we want to call out Gilead for is that after the initial inventions were made, they are still extending the protection to the drugs by making small and slight modifications, such that instead of the protection being for only 20 years, this has been perpetually being increasing. So for, when 20 years is almost over, a slight modification is made, which is not a new invention, which is nothing new, still the same drug, still the same initial innovation, and to extend this at the expense of lives. That is a practice that really excludes many people from accessing life-saving treatment. It's a practice that keeps drugs, prices of drugs still high, and it's a practice that Gilead should be called out for. Secondly, another way we will say, I will also mention that the misuse of the patent system has been also through creation of monopoly. So as Dr. rightly put, Gilead is one of the largest pharmaceuticals. It controls a large market, and it has misused the patent system to create a bigger monopoly by preventing, controlling the generic those who have the generic production of these drugs. So Gilead has excluded over 50 middle-income countries from accessing generic medicine. We know that generic medicines are way cheaper and all that. So still through the practice of a monopoly, controlling who produces the generics, controlling the prices of the companies that produces the generic, they still have been able to control the prices and ensure that the prices are still kept way high and to them, way high and out of reach of many people. So taking advantage of the patent monopoly actually limits the access to drugs. It prevents generic competition, and it's a practice that should actually be called out against. And I think that those are the two main points that I wanted to emphasize, that indeed really this practice of misusing the patent system to create monopolies, to evergreen patents should not continue, and people have the right to access life-saving treatment. Access to medicine is a human right. Without access to life-saving treatment, the quality of life of people who depend on this treatment of these drugs would really be compromised. And just noting that vaccines, medicines, these are public goods, and no one company, no one such organization should be in a position to dictate whether somebody lives or somebody dies. Okay, thank you.
Thank you. So far, we are hearing that Um, the civil society organizations are not against Gilead making money, but the extent to which the organization is going to make the profits. So we will hear from Mercy Wanjiko, the Advocacy Officer, Ambassador for Youth and Adolescent Reproductive Health Program, IREP.
Good morning, everyone. Ambassador for Youth and Reproductive Health Program advocates for adolescents and youth and young people's rights by strengthening their sexual reproductive health rights and HIV through youth-led programming. And so, as my other panelists have said, access to medicine is a human right, and we believe if adolescents and young people do not, if there is patent monopoly by Gilead, adolescents and young people would be able to access sexual reproductive health rights and HIV commodities because of the high cost of the high pricing of the drugs and also limited accessibility. So we are calling out Gilead and asking them not to prevent others to access the licensed technology to generate to manufacture generic drugs, so that we will be able to easily access the drugs. We may be able to easily access the drugs at a cost-friendly price and able to for better health outcomes. Thank you.
Thank you. So far it's stop patent evergreening, stop monopoly, allow the production of generic drugs. We now want to hear from Patricia Acero, the Executive Director, Ringa Women Fighting AIDS Group.
Thank you so much for the opportunity to be able to discuss a bit about what I understand and what my thoughts and feelings are coming from the component of women living with HIV. First, in 2001, I remember that we had close to 700 Kenyans who were dying every day. And the reason of that was there were people living with HIV and they did not have access to antiretroviral medications, which were obviously around at that time. But because of patent issues, we were not able to access them. But thank God at that time we got to realize that there's something called the intellectual property, and part of it there's also something called TRIPS. So as people who would be beneficiaries, we wanted to know more about the two. And we got to understand that in 2001, Kenya was supposed to be TRIPS compliant. That Kenya was supposed to sign into the WTO to give access to pharmaceutical industry. That people who held patent would have access to the market for 20 years as they held the monopoly. But again, within that, we got to understand that there were some safeguards, the TRIPS flexibilities, that we got to wanted to know how those safeguards could be able to assist us have access. So we understood that if there was a disaster like HIV had been declared a disaster in Kenya, then if we had the parallel importation, part of that as a TRIPS flexibility domesticated into our laws, then there was a possibility that we could be able to get generics. So as a movement of people living with HIV, the civil society, lawyers, people from the pharmaceutical industry, businessmen, we came together and we lobbied the government, we lobbied members of parliament to make sure that the TRIPS flexibilities were enacted into our laws. That was in 2001. And after that was done, Nyumbani Children Home was the first to bring in the first batch of generic medication. And that was, it was a donation. And we went to get the medication and took it to Nyumbani Children's Home. That was the first time that we saw a limelight, a bit of light at the end of the tunnel, that having generic medication could make it possible for those who are dying to have access. So come 2001, then MSF was also able to bring in another batch of generic medication. And that is how people living with HIV in this country started having access. We also got to understand that with generic drugs in the country, then, or generic production, then there would be competition and the prices would come down. So if I'm sitting here today, it's because I have access to generic medication, which was made possible by the TRIPS flexibilities that were enacted into our constitution when we became TRIPS compliant in 2001. But we also got to understand that the farmer is so greedy that they were trying to use the Anti-Counterfeit Act to deny us access. They made sure that they slotted in some within the Anti-Counterfeit Act some parts that constitute generic medications as counterfeits. So we also still went to court and fought that, stopped them from doing that, because we know apart from antiretroviral medication, 85% of the medication that is used in this country are generics. So it's not only that they blocked with the patent, but they also used the Anti-Counterfeit Act to be able to stop us from having access. So as I sit here today, there's another component that is quite worrying right now, that people living with HIV are dying from advanced HIV disease. And that is like they're dying from AIDS. And one component of that is that they're dying from what we call the cryptococcal meningitis. Cryptococcal meningitis is known that it's something that can be treated. And the WHO has given guidance on the medications that can be used. That one of those drugs is called liposomal amphotericin B, which Gilead holds a patent on, but right now the patent is already expired. But Gilead has not followed the patent laws because they have not shared the technology of the liposomal amphotericin B, or the way we gladly call it ambisome, so that we can have genetics of that. So one cost for a person right now is $500. So people who have done mathematics, can you calculate $500 times 140? Because that is what I think the dollar is going for at this time. So if you have cryptococcal meningitis, you have a terrible headache. A terrible headache. You can see, you can feel, and you get confusion. So tell me a person who is that sick, where are you going to get close to 60,000 Kenya shilling to buy one course of amphotericin B, liposomal amphotericin or ambisome for yourself, or where your relative is going to get it? So almost 180,000 people are dying every year from cryptococcal meningitis that is treatable. And the 180,000 that should be put at the door of Gilead, because they're holding the technology. There's a possibility of making generics, but they don't want that. Why? Because that patent has already expired. But when they produced the drug, it was for a different disease called leishmaniasis. It was for leishmaniasis. But right now, it has been found that it also helps to fight cryptococcal meningitis. So they don't know whether they want to have another, they want to get another patent now for new use, because that is how they do the evergreening. So we are asking and we are calling out on Gilead. Put lives of people before your profits. Stop the greed.
With that, we finish the presentations from the panel. We now invite our audience, both virtually and physically, to ask questions.
Can you hear me? Okay, yes. Thank you. Before we go too far of asking about generic, who brought these people in this country? We don't want that. I read a document, but we don't want these people in Kenya. Yes. I speak because I cover 47,000 young people, which is a youth. And that's the whole number of this country, young people. AHF has been supporting HIV programs and giving people treatment for long. we're also tired with the medication because I'm on treatment. I started taking my treatment when I was young, at age of 3. I didn't even know that I was positive. But I have taken my medication up to now. But also the planning of HF has made us to make sure that we care about treatment. If this called Gilead, I don't know, Gilead or what production in this country, why can't we sit down as a country and make sure that we pass a bill that we don't want here? And I will influence all the government, because now I'm speaking as a politician, you know, and influence all the government MPs and everybody so that we can make sure that Gilead does not exist in Kenya. And I will lead that demonstration. So I can't speak more. What we are just asking, we don't want bias in our country. So we don't want them. So they have to go. Let them go to other countries, but not here. Not let them be coming here. We have our procurement processes and everything, checks and everything. We will ask them to make sure that we don't need them in our country. Thank you so much for reading.
As a follow-up maybe to the panelists, is that possible? Just asking for another viewer. Kindly. Good morning. My name is Pauline. Thank you. In the East African newspaper. So my question goes to actually all of you. The question is why Gilead and why now? Why now? And I mean, there's so many other pharmaceuticals. Why Gilead in particular? Also, why this advocacy right now? Because I have been, someone has been very aggressively sending me press releases, and I'm wondering what's going on. Yeah. Thank you. Any of the panelists can take up the question? Why now? Mr. Tkanji, proceed.
So thank you very much. I'll start with Baridi. First of all, we are not saying that we don't want any company to come to Kenya, nor do we want to say we don't want product from anywhere in the world. As long as those products are good for our people, they are useful, we want them here. What we are saying is that we want fairness in the pricing, so that somebody doesn't produce something for 100 shillings and sell it for 1 million shillings. That is unfair. Pricing is almost like daytime robbery. Then I move on to Pauline. Why Gilead and why now? And I'll give you an example of a day I was arrested by police because several vehicles, there was a stalled vehicle in front and we decided to take a wrong turn. But because the vehicle I was using was slightly of a different color and size with the others, the police only arrested me and said, we have arrested you because it's you we could be able to pick in the crowd. Now for Gilead, it's not just that. Gilead has come sharp in our focus for following reasons. Number one, you remember the crisis we've had of COVID globally. They have had this drug called Redavicine for years, and they completely refused in the height of the crisis, people dying left and right in the entire world. They held to their patent and stopped people from benefiting from a drug they have had for many years. Even with the TRIPS flexibility, they will not budge. Number two, we know what is happening with both HIV for people who have been on treatment for a long time. They need Truvada because of minimizing the impact, chronic impact on their bones, on their kidneys and other organs. But they have held to this drug, continue to evergreen it, and kept it away from our people who need it. And finally, she mentioned about cryptococcal meningitis treatment. All those ones are drugs. The other thing we see is the amount of profit they do. Now it's clear they are making super profits because it's known how much it takes to make these drugs, and it's known how much they are paying. And then you can see what they do with the money. Last year, they paid their CEO 19 million US dollars for a single year. If you do quick mathematics, you do 19 million, multiply by 130 or 140, our exchange rate. You see that's close to how many billions? All these at the expense, because they are overpricing. To us, why we're focusing on them is because their mantra, right now their corporate mantra is profit above all else, at whatever cost. It doesn't matter how many people die. It doesn't matter how many people proceed to chronic liver failure, how many people get cancer of the liver for something that could have been prevented. For this reason, we have focused on them. And this is, I think some politician, I won't mention names, they are so used to saying, ukiona cha mwenzako kinanyolewa ufanye nini? Utie chako maji. So when we are talking about Grid Pharma, it is not just about Gilead, but we've decided to focus on Gilead for those reasons, that they are holding patents, they have evergreening patents that should be long gone. We should be doing those generics. We should be even doing those generics here. There are many companies even here in Nairobi which can produce those generics. Even where they claim to have given licenses to companies outside Gilead to do patented, they are contracted them such that they control the price at which the drugs will be given to the users. So they do not even allow the competition we talked about when many companies come. They do not even allow that. They control even the price at which they will be produced, even when they've been produced in cheaper countries, in places where it's much cheaper to do business, like in Asia. So for this reason, we've decided to do that. And given that AHF is a core job and mission is about ending HIV as a global pandemic in the world, it hurts the clients that we take care of, people who are living with HIV, whether they are newly found, whether there are those ones who have been on treatment long time, they need the best treatment to remain healthy and productive. And we also concerned because hepatitis, when it infects somebody with HIV infection already, the combination is deadly. So this is the reason why Gilead is on our radar right now.
Okay, thank you so much. Thank you so much, Dr. Kanjui. I'll take 2 more questions from the floor, and then we can have the panelists respond on them.
Hello, good morning. My name is Austin Mirambo from KBC. You've talked about the Gilead mantra, which is profit at all cost. That's pretty loud. And then, do we really need Gilead? Yes, we do. Should they change how they trade? Yes. My first question is, you've talked about monopoly and matters relating to patent being the major contributors to lack of access to ARVs. Is there data to back this up, and how is this really affecting the less fortunate? You've talked about amphotericin. I'm not a doctor yet, but you've talked about amphotericin B being at 60,000. So how is it affecting the less fortunate, and is there data really to back this up? And then my last question will be, how can women really actively push back against what you've called the greed of Gilead, that are putting critical medicine out of reach of the less fortunate? Thank you so much.
Thank you. I hope you have noted that down. We have one more question.
Thank you. Good morning. I'm Macau Kennedy from MISA, that is a Mother Sports Association. And to me, I'm just wondering about this Gilead. Do they care about our generation, that is our youth? I'm just trying to look that 60,000 per dose, that is our drug for the crepal meningitis. And I'm just wondering, there's a youth who are, the biggest number is not even employed. They are able to afford, even if you put a 10,000 per dose. So to me, I'm just saying that it is high time we bring the heads together, and we have to push them down to reduce the price, because we need each other. And by the end of the day, the youth are the one who are going to suffer, and they are the biggest population. Thank you.
Thank you very much. Maybe we can start with Patricia.
Thank you so much for the questions. So let me start with the one for liposomal. It's called liposomal amphotericin B. Liposomal amphotericin B. I've just said that people living with HIV are now dying of advanced HIV disease. And one of those causes are cryptococcal meningitis. There's data of the people who are dying of cryptococcal meningitis. But from where I sit, as a woman living with HIV, working in the community, like 2 months ago, I was in a meeting and I was called that there's one lady who was in a particular support group, those sites of Migori, and she's in hospital. They've found that she has meningitis, and now the crypto medication is needed. So by the time I was still dilly-dallying and the others were trying to look for money to make sure that she gets the medication, we were not able to. That woman died, and she was a widow with children. Her children are left by themselves. But for me, that is one death too much. A death that I put on the head of Gilead, who are making sure that we do not have access to the medication that we need. Even if you are the doctor at that particular time, you've made the diagnosis. What else can you do if you don't have the tools to be able to treat your patient? And the person who is holding that tool is called Gilead, who is making sure that even our government is not able to afford those medications. There's data that thinks close to 180,000 people die from cryptococcal meningitis in the world, but 75% of that is in sub-Saharan Africa. There is data about that.
So I'm going to echo your sentiments, from Maisa, that adolescents and young people in all their diversities are not able to access sexual reproductive health rights and HIV commodities due to the high cost of production and the limited availability. And this is due to patent monopoly that is being influenced by Gilead. And so as young people, our call to action is making sure that Gilead grants access to other manufacturing companies to be able to produce sexual reproductive health and rights and HIV commodities and drugs and life-saving drugs, so that we may be able to access these drugs at a low cost, and we may be able to access these drugs at a cost-friendly price and at a low cost for better health outcomes and for a healthier generation.
Okay, thank you. So I think on my side, just to re-emphasize, I hope it's clear, just to re-emphasize what has been said by my fellow panelists. Okay, so just to re-emphasize what has been said by my fellow panelists around engages in practices that we see these are not good practices, we have to come out clearly and call them out. So that is important. And it is what we are saying specifically when it comes to patent monopoly and evergreening. These are practices which we are saying no, do not continue with this. And why I should also just mention the importance of why we need to have access to these technologies to be able to access generics. I think we saw the situation during the COVID pandemic when the global north was, we were left on our own, we were left on our own. So if we do not speak out when in position to be able to have access to generics, to be able to have a local production of this, then we stand at a very big risk, and that's why we should be concerned about this.
Thank you. There's one question from the virtual team. From Gerard from Machakos is asking, when will this conversation be available at the grassroots level? I think Dr. Kanju, this is for you.
Before Doctor, I think I can just
yes. Okay. Go ahead. Make it short, Baridi. Thank you.
As a HIV-born, HIV positive, I'm living in this country. Generic medication is not the routine that we have. So, as Doc said that we are not facing them outside, but we need them also. How can we work together to make sure that they give us a productive, a good medication? Because I'm worried. I mean, second line. The third line is, if I go to third line, I'll be dead. I'm in second line. And I've stayed with this virus since I was born up to now. Now I'm coming to be a youth and adult. If Dr. Kinyanjia said that we are not chasing them or whatever it is, how can we make sure that we have not generic drugs in our country?
Thank you. Then I think after this, I'll take it back to the moderator, Dr. Kanju, on the grassroots advocacy.
So thank you very much, Gerard. We are happy that you have gotten the message, and from your question, it's clear that you are part of the team now that standing up and speaking up to tell Gilead that your practices for focusing only on profits at the expense of lives of children, women, people in the world is unacceptable to the civilized world. So we will be moving this advocacy agenda to various levels. The dates are not clear for now, but when that time comes, given that you've logged in, we should be able to reach out to you in Machakos so that you can also become part of the movement. The point I'd like to make here is that, and maybe for Baridi and for other people who confuse generic drugs with the counterfeit drugs, with fake drugs, is that generic drugs are not counterfeit drugs. They are very good drugs. The difference between generic drugs is the container and the branding that is put on them. Otherwise, the active molecule is the same. If it's paracetamol, it is paracetamol. If it's amoxicillin, it's amoxicillin. You can call it amoxil, whatever you can give it a name. It is like any like petrol. If you put petrol in a container that reads Kasuku, it remains petrol. If you move the same petrol and put it in another container that reads Joma, it remains the same petrol. So what for marketing purposes, companies who are the initial manufacturers, they call their drugs branded drug. The difference with that and the generic is making the exact same drug but giving it a different name. They are licensed, when the license runs out after 20 years, of a patent, then the molecule and the way of making that molecule is known globally. So anyone can take that formula and use it to make that drug and give it their own name. You can actually have your drug and call it Baridi 1 and create another one. Take somebody else's formula and create Baridi 2 for treating whatever you're treating. So long as you're following the laid down good manufacturing practices and your factory is WHO pre-qualified, then those drugs will meet the international requirements. And we have a lot of companies in Nairobi here making a lot of the drugs that are keeping me and you and other people healthy and alive. So do not confuse generic with counterfeit. Counterfeit are drugs who we do not know the manufacturer, that we do not know the content, that we don't know where they were made. They are fake. So they could be, most of the time, they are substandard and are dangerous. But generic drugs is the actual good drug, only that is made by other companies rather than the original manufacturer. Most of them will be start to be manufactured after the patent has run out. And that's why we are calling on Gilead, because it's holding on to the patent even after the time the patent should be out there. The formula should be out there to allow other manufacturers to manufacture these drugs. Why are the drugs manufactured in other places cheaper? The cost of manufacturing is cheaper. The cost of labor is cheaper. The cost of power is cheaper than manufacturing in the US or Europe. That's why drugs manufactured outside those developed countries, they are much cheaper. It's not that the quality is bad. No, the quality is good. The issue is that the production, where they are produced, it's cheaper. You'll appreciate that a soda here, where we are in this hotel, is it the same price as a soda outside there in the Kibandaski? Is it? Does it mean that the soda here is a different content than the one being sold at the Kibanda? No. It is all made by Coca-Cola, or is all made by whoever company has made, but the environment is different. So things were done by the initial company are branded, sometimes 3, 4, 5, even 10 times more expensive. And that's why there is a requirement that after 20 years, you must have recovered your initial cost, made profit. Then it's time to allow the drug to be manufactured en masse to meet the needs of the rest of the world. The other thing is also regional pricing. You cannot price the same thing in Europe the way you price it in the global south, where the economies are either developing or emerging markets. They should have those different in pricing. But when a company like Gilead is only focused on profit, they use legal and sometimes things that may border or not being illegality to remain focused on profit. And I mentioned something here that worried me during this this campaign. I talked to a lot of my senior colleagues, lecturers, and some very senior people in the research industry, in the research field, and many of them did not want to come and talk about any farmer, because a lot of their research is funded by the pharma industry. And the farmer uses clauses in the contracting to keep them from saying anything that may be contrary to their interest. I believe you are with me. So our brightest and most resourceful scientists, they are being twisted, even to stay away from saying things that they may know are not right. I think that should worry everyone. Myself, I'm very worried about that.
Thank you very much, Dr. Kinyanjui. As you have all seen, this is a very important issue. It affects all of us because as a country, most of us rely on generic production of medicine for all diseases, including COVID-19, meningitis,